The time period is 1960 to 1979.
Hello everyone and welcome to OT Talk. Today we will be speaking with some inspiring leaders of occupational therapy. Society as we know it has been changing rapidly. Just recently, President Johnson signed a Civil Rights Act into law, protecting people's rights in voting, education, and employment. He also signed the Medicare and Medicaid legislation of the Great Society, providing access to our brothers and sisters with disabilities and those suffering from poverty. On the bad news side of things, due to lack of funding, our mental institutions have been closed down, and many people with a mental disability have been left homeless. So as our first guest, we do have Mary Riley. Mary Riley, how are you doing today?
I'm doing good.
Nice to
How
have
are you?
Thank you for coming.
Yes, thank you for having me.
So go ahead and tell us a little bit about yourself.
So, my name is Mary Riley. I was a clinician with the U.S. Army, and after that I got my doctorate in education, where I became the head of rehab for the Neuropsychiatric Institute at UCLA, and then I became a professor at USC, where I kind of built my whole philosophy on occupational therapy and the idea that occupational behavior should be the background for occupational therapy. And basically, occupational behavior is a holistic view of humans and the occupations that they do. So the activities that are meaningful to them and that encompass their daily life. And I also believed that we were really stuck in the medical framework. And to define ourselves as our own profession, we needed to move past that framework and create our own sort of framework. So I see that as being something that we need to do in the future, create a framework. And so then I created the occupational behavior frame of reference. And that's what I've been doing.
Very nice. So I hear there's a famous quote of yours. Would you mind sharing that with us today?
Oh yes, this quote represents my framework, and it's man through the use of his hands, as they are energized by mind and will, can influence the state of his own health. So basically the occupations that we engage in and being able to engage in those occupations helps us be healthy beings. And another concept that I've been looking into is the concept of play. And I kind of believe that play is the background of all of our occupations and how we develop into occupational beings as adults. And right now there's not a lot of scientific background behind that, which I think there needs to be, because I think play is a huge, huge component of who we are and who we develop into.
Very nice. Thank you. Thank you very much. Round of applause for Mary, everyone. Thank you. Next up, we have Dr. Anna Jean Aries. Doctor, how are you today?
Good. How are you?
Nice to have you on the show. So go ahead and let us know a little bit about yourself.
Well, hello everyone. I got my bachelor's and a master's degree at USC for occupational therapy, and I also got my PhD in educational psychology at USC, where I now teach at the occupational therapy and the special education departments.
Very nice. Okay. Anything else? Like, what are your contributions to occupational therapy, or can you elaborate more on the field?
Yeah, I have been developing the theory and the associated intervention techniques of sensory integration by examining the relationships between the human brain and the behavior. I've been using tests of sensory integrative and practical functions with children with and without learning and sensory motor difficulties.
Very good. Can you tell us what your plans are for the future?
Yeah, I'm actually about to open my own clinic. It's going to be called Aries Clinic. It's an occupational therapy clinic for both children and adults. And I will be combining teaching, research, and practice to develop my practice model of sensory integration.
Very nice, very nice. So everyone out there, you know, Aries Clinic, keep that in your notepad. And thank you very much for sharing with us today. And lastly, we do have Dr. Elizabeth. Doctor, how are you today?
I'm very
Nice
well.
to have you. Okay.
Thank you.
So let us know a little bit about occupational therapy.
And occupational science.
Mhm.
So right at this moment, occupational science is not it's not its own discipline, and I feel that we need our own science to go along with occupational therapy. Since right now, the science of occupation is just a basic science, so there's not really any applied knowledge and like practical knowledge that we can pass on to our clients.
Very good. And how was it for you? I hear that you had the honor of being in the Eleanor Clark's Slagley lecture.
Oh, the lecture, yes. Right. So in 1966, I gave a lecture at USC called Authentic Occupational Therapy. At this lecture, I talked about the importance of qualitative research, since empathizing with our clients is the only way we can actually understand their occupational needs, and that I think is the grounds for our science. And so with occupational science, we can also like justify the significance of our work as OTs to insurance companies, so that we can get the funding and the societal acceptance for everything.
Amazing work. Thank you very much. A last round of applause for our ladies. And lastly, unfortunately, we were not able to have Wilma West with us today. She is a president of AOTA, and she has renewed the importance of science development in occupational therapy, and has helped establish the American Occupational Therapy Foundation to advance science of the field and increase advocacy. So a round of applause for Wilma West as well. Any last words?
Yes, I would like to thank Gail Fiddler for her emphasis of the use of occupation as a means for emotional expression. Gail got her background in psychology, and she is a leader in the mental health field today. So thank you, Gail.
And also Anne Mosey, who advanced her work.
Yes, Anne Mosey. How could I forget about her? I'm sorry, Anne Mosey. Thank you, Anne Mosey.
Also, thank you to Lorna Jean King for starting the application of the sensory integrative theories to persons with schizophrenia.
Thank you.
Great.
And also thank you to Claudia Allen for developing theories of cognition to guide our mental health therapies.
Very nice. Thank you very much. And don't miss our next show tomorrow, starting at 6 p.m. sharp. OT Talk. We are out.
Woo!